top health authorities in the U.S. have released fresh guidelines for healthcare workers returning from Ebola-hit countries to ensure the spread of Ebola is contained within its borders. And to tell us more, Paul Lee is joining us from the News Center. Paul, there's been heavy criticism of mandatory quarantine measures recently introduced in some states. So will these new guidelines address those concerns?
Well, the U.S. Centers for Disease Control and Prevention is trying to provide recommendations for standard health protocols related to Ebola across the country. However, the CDC has no overriding authority over state quarantine measures, which can be confusing and even conflict from one state to the other. The White House and civil rights groups have criticized the quarantines imposed on a handful of states on medical staff, regardless of whether they showed any symptoms. They stress that U.S. policies need to be guided by science and not discourage volunteers from going to countries hardest hit by the Ebola epidemic. On Monday, the UN Secretary General Ban Ki-moon's office issued its own strong words on the matter.
The Secretary General is concerned by the recent restrictions put in place in several countries and localities applying to people who have traveled to the main Ebola-affected countries. Returning healthcare workers are exceptional people who are giving of themselves to humanity. They should not be subjected to restrictions that are not based on science. Those who develop infections should be supported, not stigmatized.
Meanwhile, the Australian government has stopped all processing of humanitarian and immigration visas from West African nations affected by the deadly virus. Australia has not reported a single case of Ebola, but has had a number of health alerts, including an 18-year-old African woman who tested negative on Monday.